Professor Tricia McCabe is Head of Discipline and Professor of Speech Pathology in the School of Health Sciences at the University of Sydney. She is Honorary Professor of Speech Pathology at Liverpool Hospital in Southwestern Sydney Local Health District and a Fellow of Speech Pathology Australia. And I welcome her tonight to talk to us about how to get the most out of telehealth services and what to expect from your health professional.
Thank you, Kate. And it's a delight to be with everyone this evening. So what I want to talk about is a completely different angle. This is what are you going to expect if you go into a telehealth model, and what you can expect from yourself and also from your healthcare professional. I've used healthcare professional to try and stop saying speech pathologist and ENT. So let's just use healthcare professional. And of course, if you are using telehealth with other healthcare professionals, all of what I've got to say this evening would apply to those interactions. A number of things I want to talk about: consent, which is an important concept in health provision. In addition to consent to be treated in a particular way or to undergo procedures, we need to also have consent to telehealth and consent to the telehealth recordings that might happen. So I'll talk about that. I'm going to talk about your preparation, what you can expect from your healthcare professional. I will talk briefly about software and systems and technological issues, just to reiterate some of the issues with the technological approach to intervention. Oh, I have preparation twice on my slide. Never mind. And maybe I'll reiterate what to expect from your healthcare professional. So, informed consent. Informed consent means you understand what the benefits and risks are of participating in a telehealth health encounter, whether it's an assessment or a treatment session. So, of course, the first is that you have a reduced risk of acquiring COVID-19, or if you have and you don't know that you have COVID, then you also have a reduced risk of passing it on to other people as you go. It is likely that this is going to reduce the waiting time to see a clinician, and particularly if you're wanting to see a clinician who is specialist in a particular area. So if you want to see a specialist voice clinician as opposed to a generalist speech pathologist, you will get seen sooner if you are able to participate in telehealth. You avoid the need to travel to the service, and that has two benefits to you. So the benefits of telehealth would be that you don't have the travel time yourself, but also that you're not exposed to the virus while you're traveling. And this finally will help the service better look after you. If we're able to do some of the work on telehealth and some of it face-to-face, or all of it via telehealth, then we may be able to help you more effectively. The consent you need to understand is that while these are the benefits of telehealth, you may not get all of these benefits. They may not all apply to you, and we may not, in fact, help you. So you need to understand that. The second piece is the risks. A video consultation is not exactly the same and may not be as complete. And already each of our speakers has talked about the things that are included and the things that are left out. Unlike a face-to-face interaction, sometimes telehealth is affected by technical problems, and we haven't had any yet, but it's very possible that some of you are having those technical problems at your end. Some problems that we could pick up if we were with you may be missed or may be misdiagnosed. And so this is where that triage process that Chris talked about, and also that importance of sending extra information, so making recordings of your own voice and sending it to your voice clinician, may be important. Healthcare professionals are required by law in our professional codes of practice to use systems that meet the standards to protect your privacy and security of these kinds of visits, but there is always a risk that those services will be hacked, where there may be interference that your materials may not be as confidential as you would like. And so you need to understand that these are the possible risks and that you're willing to take those risks. If you're not willing to take those risks, then you need to have a conversation with your healthcare professional about why you're not willing to take those risks. And for some people, that can be very much centered around the issues of privacy and confidentiality, because between me and my computer is air, but after that it's electronic. And so our systems are only as good as the weakest part of our system. Are you using a confidential interaction with the internet? Is your service provider good? Is the software that's being used good? And the same at the other end with your healthcare professional. So they're the issues in informed consent. You should expect that your healthcare professional will discuss these with you either in the first appointment, or preferably that they will have sent you this information prior to your telehealth encounter with them. And I certainly know that most of the colleges of medicine and Speech Pathology Australia have all provided this kind of information and templates to their members. So before you join into a telehealth session, you need to ask what's going to happen so that you know what to expect and what you need to do to be prepared. So the clinician or their receptionist or whoever should be able to give you information about the platform, the security, what the requirements are for your computer, whether you should be wearing a headset microphone or whether you can, as I'm doing now, get away without one. For most voice cases, it would be preferable that you wore one, because that will mean that your voice is optimized for the clinician to listen to. You will need to be in a quiet, well-lit private space away from other people, and in the case of your own voice quality, away from your pets. Dogs barking just at the moment while you're trying to say something important could be a significant interruption. So try to have as little distraction as possible. Check that your system and the devices are compatible. So check that your camera works, that your microphone is appropriate and that it works with your computer. Check that your computer works with the service that the healthcare provider is using. So I use CoView in my telehealth appointments. CoView works well, but you can't screen share if you are using an iPad or a phone. You have to be using a full laptop in order to screen share. So those kinds of questions are important. If you are feeling uncomfortable with the IT, can you have a support person with you? And there's two parts with that. One is so that you feel that you're secure in your session, and secondly, so that if things go wrong, that it can be resumed quickly and you don't lose out on having that vital health service that you're looking for. As I said previously, do have a plug-in or USB microphone, so it might plug into your headphone jack, or it might plug into the USB port. That is important to ensure the sound quality of your voice is as best as it can be. And your healthcare professional or their reception should send you a troubleshooting guide and the consent forms in advance. At the start of the session, you should expect that your healthcare professional will do a couple of things. Firstly, that they will confirm your identity, that you are not just someone who's seat warming while the actual patient went and got a cup of coffee. That you have understood the informed consent regarding the risks and benefits of telehealth. If they would like to record the session, they should advise you that they would like to record and separately obtain consent to record. And if that separate consent is verbal, they do it at the beginning of the session, then they should do that at the beginning of every session. If you would like to provide them with written consent to record all sessions, you can do that. But if it's verbal, then each session. And they might like to use the chat function. I noticed some of you have been using the chat function in Zoom, which we're using today. there's a chat function, and in that chat function, they can then provide you with various different means to understand some of the vocabulary they're using. The other way they can do that, and I'm going to do that now, is they can use a function called annotate. So here I'm adding to my slide by typing and or drawing. So I might point to something here, or I might use a stamp that sort of says, no, not that one, instead this one. And so by using that annotate function, they're going to help you understand things. So hopefully your healthcare professional has mastered the technology associated with the session that they've created for you, and you can expect that they might do those kinds of things on the screen with perhaps drawings, anatomical models, and so forth. Okay, coming back to my slides. The next two slides talk about the advantages and disadvantages of free and commercially available systems of technology. And there's another typo. Okay, so there's a whole range of free services, most of which most of you will have heard of. So Skype, Zoom, FaceTime, WhatsApp, Google Hangouts, and so forth. Now, this first lot in black are all services that are free and have low security and low privacy. However, they are familiar to people, and they often are very good across platforms. The exception, I guess, is FaceTime, which requires an Apple platform. There is one free service available which has better services for health encounters. It's called Doxy.me. It's aimed at medical encounters. But do be aware that with all of these free services, the data is the product. So your signing on, your using of the system is how the service makes money. So they provide you with ads, or you have to sign up to say you'll receive emails from them or something like that. So do be careful if a healthcare professional is using any of the free versions of these services, because you and your healthcare professional are the product that is being sold to advertisers. So ask in these cases, where is the data being stored? So at the moment, Zoom is recording this, and because it's a University of Sydney Zoom account, this is being recorded on a university server, so it's quite secure, and we can understand that it's as secure as the university can provide. However, if I was doing this of my own accord, we would not know where that was being stored, and lots of this information is stored in server banks internationally, so we don't know who is able to access that information, and is this compliant with the Privacy Act. So your healthcare professional needs to be asking these questions, but so do you. Alternately, there's a whole lot of paid systems, so Skype for Business, Zoom, Microsoft Teams, Cisco Jabber, and so forth. These are all generic conferencing platforms, and then the ones in purple are designed for medical settings. So Doxy.me, Scopia, CoView, and PECSIP are all designed for medical settings, and so they have a few extra precautions built in. If your healthcare professional is using any of these, then you can be assured that the security and privacy is better, but it may not be perfect. And you may have heard in the news about Zoom bombing early in the epidemic. People were randomly selecting Zoom rooms to join in on, and of course that caused some problems. One of the problems with these paid services is sometimes they're more expensive in terms of bandwidth and the speed requirements of the program. So you may lose some quality because they're uploading more data. So if you're on a limited budget, some of these will be a problem. So in technology, the slowest link is the one that's causing the delay. So is it your computer and is it attached to the Wi-Fi? Is it on Wi-Fi or is it plugged into your modem? Is it your, are you on um, the NBN or are you on some other kind of service? Are you hotspotting from your phone? All of these steps, and the same at the other end of the healthcare professional, are where the slowness comes from. And whichever piece of the chain is slow is what's going to cause lag and delay and breakup of video and distortions of sound cutting in and out. So some difficulties might come if you have to download or install an app. Please do that in advance. That will make it easier for you and for your healthcare professional. Make sure that you have sufficient credit or data available for the video conferencing of the telehealth. If you have a hearing aid or you have some kind of hearing loss that you're not yet aided, then you may need to get some specific advice from your health professional about how to manage the output from the speakers. So it's not only what you say and what your microphone picks up, but also the quality of your speakers. And in that case, you may wish to wear over the ear headphones rather than earbuds, or using the computer speakers. And some people will have difficulty managing multiple channels simultaneously. So that is having 2 or 3 things going at once. And so if you're having trouble because of your technology, ask your healthcare professional to do one thing at a time, rather than have you look at a website and at the same time be on Zoom and so forth. So negotiate that with your healthcare professional. Finally, you might have difficulties if you're on a Mac and they're on Android, or vice versa. Or you're on a Mac and they're on a PC. So do check out the compatibility across systems as you're preparing for your telehealth. So some questions you may want to ask about the telehealth technology: what encryption is being used? Encryption is coding or making secret of your data. So what is being used there? Where is the data, that is the video or the audio, being stored? If it's being recorded, where does the recording go? What is the bandwidth or speed required for effective use? And Telstra has, and the NBN has, if you're not a Telstra customer, you can measure your speed, your upload and download speed, with the NBN or with your internet service provider, and that's a very useful thing to do to know whether your telehealth's going to work. One of the things you might choose to do is to unhook everything else from your broadband. So that might be to tell your phone and your iPad not to be on, you put them on airplane mode so they're not accessing the Wi-Fi. So if you're having trouble with internet speed, that is one thing to do. Another thing to do is to go and purchase, you can get them for about $5 from Officework, a cable that plugs your computer directly into your modem rather than using the Wi-Fi. So if you're having trouble with your internet speed, both of those things are things that can increase the speed. So I've talked about all of those things. Some audio hints. Put everything else on silent. And that would include, if you're doing your telehealth appointment by your phone, you need to turn off the other components. So if you're using your phone as your Wi-Fi device, you're hotspotting from your phone, make sure you can't receive calls during that time, because they will distract you, and they may also stop the sound from your telehealth appointment. Try and minimize background noise. It can be very helpful to have a soft surface. So if I just now tap on the table, you can hear that, and it's interfering with the sound of my voice. So try and avoid having those kinds of things. If you're a noisy typist, then don't speak and type at the same time if you're worried about your voice quality. As I've already said, use an external or a headset mic. You saw Dan previously, Dr. Novakovic, using the microphone, and he was holding it up under his chin. If you have an external microphone, have the microphone below your lips. Don't hold it up here. This is not an AC/DC concert. Hold it down here and hold it so that it's in the same place and is not going backwards and forwards. This is why we recommend a headset mic, because that will keep the microphone, even if you turn your head, the microphone will go with you. If you're using a microphone and you want to have it on a stand, make sure that it's on a firm, flat surface as close as possible to you. Avoid turning away from that microphone. So as I said, a headset mic will go with you. And speak at your normal volume. The microphone has settings on your computer. Use the microphone settings to change the volume so that your volume goes up, but that's a constant, and don't change it session to session, rather than over speaking or speaking too loudly, which can cause more trauma, more phonotrauma. So if you're very, very soft and your clinician is not hearing you, discuss with them whether you should do the microphone boost using the computer's capacity rather than trying to overspeak yourself. In terms of video, ensure you have good lighting in the room. You'll notice that my lighting is relatively subtle. It is actually easier to see someone if they have side lighting rather than if they have front lighting. It's much harder to see what people are looking at and what they are doing when they're completely front lit. So side lighting can be good. Make sure you don't have any lights behind you. You can see above my head there that I've turned off the light behind me because that makes it difficult to see you. Check your camera angle. You really don't want to be doing this or that. So think about lifting the laptop if that's a useful thing to do. Avoid wearing brightly patterned clothing because that can interfere with the video signal. And some systems, Zoom is one, you can have the audio from your phone and the computer from your video. And of course that helps prevent buffering. And as Kate started at the very beginning, and I think Dan said as well, is use video where possible, because our communication is much more effective when we have facial expression and body language to help us interpret what somebody's saying. So, final slide from me. Know what to do if there's trouble. One thing you can do is turn off the video and see if that helps. Switch to cable or phone hotspot and call your health professional as per whatever the plan they've given you. Who's going to call? What number are they going to call on? That should all be established either immediately prior to the session or at the very beginning of the session. Know who will call who. And if you're sent a troubleshooting guide, keep it handy because this will be, you'll be flustered, and it's very good to have it right there so you know what to do step by step. And that is my guide to starting in telehealth if you haven't done so already.